Okay, good morning, everybody. Thank you for joining us. Today, the presentation is on ensuring home health agency eligibility and staffing compliance for Medicaid health plans. Today, our presenters include Shamaria Davis with the Bureau of Medicaid Policy, Dale Mooney with the Division of Health Quality Assurance, Nick Constantino with the Bureau of Medicaid Fiscal Agent Operations, and Patricia Cobb with the Bureau of Medicaid Policy joining us on the phone from the St. Petersburg location. Just some housekeeping rules for everyone on the phone. Everyone's line is muted for the duration of this presentation today. There will be time at the end of the presentation for questions. If a question comes up during the presentation, please just type it into the questions pane on your computer, and we will address the typed questions first at the end. And then secondly, when it comes for questions at the end, we ask that you use the raise your hand feature, and we can see who has a question, and I will unmute that single line so that you can ask your question over the phone. And then finally, the presentation is available after this training. It will be posted on the SMMC website where you can access it there, and you can get more information about that after the training today. So we will go ahead and get started with the introduction.
Good morning. I'm Shamaria Davis with the Bureau of Medicaid Policy. This training is being conducted by the agency to help Medicaid health plans summarize the requirements, the credentials and qualifications that a home health agency must have prior to being enrolled in their network, their provider networks, and prior to rendering skilled nursing services. And we also want to remind everyone that this material is only provided for training purposes and does not constitute legal guidance on Florida law governing the licensure and qualifications of home health providers or to interpret or modify agency contracts with the SMMC plans. Plans should consult with their own legal counsel. First, we're going to give you guys an overview. So in this webinar, we will discuss the following: who can provide Florida Medicaid skilled and non-skilled nursing services, how to validate a provider's credentials, registering a new provider with Florida Medicaid, some frequently asked questions, we'll look at some helpful resources, and the ad hoc report. So what are Medicaid home health services? Under Florida Medicaid, home health services are considered to be medically necessary services that can be effectively and efficiently provided in a recipient's place of residence. Under our home health services, we have two categories of services. The first is skilled nursing services that include home health nurse visits, which are face-to-face contact between a registered nurse, licensed practical nurse, or a home health aide, and a recipient at the recipient's place of residence. We also have private duty nursing, which will be referred to as PDN throughout the rest of this presentation. PDN are medically necessary skilled nursing services that are provided to recipients under the age of 21 in their home or other authorized settings. And this type of service is to support the care required by recipients' complex medical needs. The second category is non-skilled services, and under non-skilled services we have personal care services. Personal care services are medically necessary assistance with activities of daily living and age-appropriate instrumental activities of daily living that enable recipients to accomplish tasks that they would normally be able to do for themselves if they did not have a medical condition or disability. And again, personal care services is only for recipients under the age of 21. Next, we'll look at how to determine if the provider is qualified to provide skilled or non-skilled services. We'll first look at who can provide skilled nursing services. Home health agencies, which will also be referred to as HHA throughout the rest of this presentation. A home health agency must be licensed in accordance with Chapter 400, Part 3 of the Florida statutes, and Chapter 59A-8 of the Florida Administrative Code. A home health agency must also have a AHCA license that covers the enrollee's county of residence. A home health agency must be licensed for skilled care services by AHCA's Division of Health Quality Assurance. A home health agency must be Medicaid enrolled or registered. And if they're registered, the home health agency must either meet the Medicare conditions of participation or be accredited. And this information will be going over further in detail later on in this presentation. And a home health agency must be able to staff the plan of care at 100%. Additionally, independent home health nurses also can provide skilled nursing services. An independent home health nurse is a new category of providers that was added by the agency. An independent home health nurse must be licensed as a nurse in accordance with Chapter 464 of the Florida statute, must be Medicaid enrolled or registered, and a home health nurse can only provide services when there is no home health agency provider available in the area to furnish the care, and this is in accordance with Title 42 Code of Federal Regulation 440.70B1. All right, now we're going to look at who can provide non-skilled services. A home health agency, again, can provide non-skilled services, and we have listed the same requirements as previously for skilled services. And the additional non-skilled services provider is independent personal care providers. They must meet the home health licensure exemption requirements that are defined in Section 400.464 of the Florida statute, and they only may furnish personal care services to persons with developmental disabilities as authorized under 400.464 subsection 5B3 of the Florida statute. And I did just want to point out that developmental disabilities is also referred to here at the agency as individuals with intellectual disabilities. An independent person care provider must also be Medicaid enrolled or registered, and they also must be able to staff the plan of care at 100%. All right, so now we're going to move on to home health services plan of care. There are certain situations that require services for more than one home health provider in order to provide all the medically necessary care that's ordered by the physician for the recipient. The expectation is that each home health provider would be responsible for coordinating their plan of care with the other involved home health provider to ensure that there's a continuity of care and that the recipient is receiving all of the care as prescribed by their physician. Additionally, home health agency staff must follow the physician assistant, or advanced registered nurse practitioner's treatment orders that are contained in the plan of care. And this is in accordance with Section 59A-8.0215, subsection 2 of the Florida Administrative Code. Okay, everyone, I'm now going to turn things over to Dale Mooney.
Good morning. My name is Dale Mooney. I'm with the Division of Health Quality Assurance. The first thing that we're going to talk about in the same section is the home health agency licensure exemption. I wanted to just make sure that everyone is aware that home health agencies that are providing skilled or non-skilled services are required to follow AHCA licensure requirements in Chapter 400, Part 3 of Florida statute when those services are provided as a health plan network provider. The only exception to that is for personal care services provided to persons with developmental disabilities that's authorized under 400.4645B3 of Florida statute. There are several other exemptions in 400.4645B of Florida statute. However, those exemptions do not apply to health plan network providers. The next section that we're going to talk about here is validating provider credentials. There's a couple of steps to determine provider credentials. The first one would be to utilize Florida Health Finder. The second would be provider master list and pending provider list. I'm going to review Florida Health Finder information with you, and then I will pass it over to Nick Constantino to talk about provider master list and the pending provider list. The first step to determining provider credentials is to verify information on Florida Health Finder. This is an agency website that was developed that's intended to provide easy access to healthcare information. Facilities or provider section allows users to search for health facilities that are regulated by the agency. We've provided you the link here, and it will be provided again at the end of the presentation in our helpful resources section. This is a screenshot of the landing page for Florida Health Finder. In the lower right-hand corner, you will see underneath locate facilities or providers. In order to locate a home health agency or any healthcare provider regulated by the agency, you'll want to select facilities or providers. That will take you to this page. This is our facility locator homepage. The most efficient way is to search by facility type or location. Since we're specifically talking about home health agencies today, that's what we're going to step through. From the drop-down menu at the very top of the screen, you're going to want to select home health agency. If you know the provider's license number, you can type it in, and that will take you directly to that provider's record. You also have options to search by provider name, although I would urge caution if you're using the name. Oftentimes the enrolled provider with a plan is the legal name. The name that is going to be showing here is can be a fictitious or a DBA name, so there may be some discrepant information if you search by name only. You can also search by street address. County of operation would return any facilities that are located in that county. If you happen to have an AHCA file number, you can also search by that. Again, the most efficient way is to go directly to the license, use the license number and go directly to the record. There are a few advanced search options that have just been brought online in order to help providers. In this section, you can search by certification status, and that is the Medicare and or Medicaid certification status, the facility's license status, their service area, which is the one or more counties in which they are licensed to operate. Special designation will tell you whether they are authorized to perform skilled care services or are limited to non-skilled care services only. And pediatric services is an informational search designation. These are providers who have told the agency that they already provide skilled services to pediatric clients under the age of 21. This is informational only, and it is not permissive. And we'll talk about that a little bit further as we move through. So in this screenshot, you can see what a provider-specific landing page would be. In this case, we did a search for America Loving Care Home Health Incorporated. By the return, that is telling us that that is an active provider just because you found results. And you can also see their street address and phone number. If you click on the orange name, American Loving Care Home Health, that will take you to their profile page. This is the profile page for America Loving Care Home Health Incorporated. There's plenty of information available on this page, and it would also be reflected for any other home health agency, both their street address and mailing address. In the first squared box, which is just highlighted in red for the purposes of this presentation, if the provider is accredited by a recognized accreditation organization, the name of that accreditation organization will appear here. This is based on information that was reported to us at last licensure application, and we do update it if we get any interim information or feedback from the provider. So if they have a change in accreditation status that they report to us during the licensure period, we would make the updates to the record. Emergency actions, if a home health agency is subject to a suspension or any other type of emergency administrative action taken by the agency, those findings would be there. We publish inspection reports for surveys that are conducted by the agency, whether they be complaint inspections or licensure inspections. We would provide that information for substantiated complaints and for any licensure inspection. We have compare quality and or pricing data. This, if you click on Home Health Agencies link there, that will link you to the CMS website that will give stars ratings for home health agencies based on, and that only applies to Medicare certified home health agencies. So if your particular provider that you're looking for does not participate in Medicare, there wouldn't be any results for that provider. Under services and characteristics, this is very important information. The service area contains the county or counties in which the provider is authorized to provide services. If your enrollee or your participant does not resides in a county that is not reflected on this particular provider profile, this home health agency is not authorized to provide services to that individual. We'll talk about it a little bit more in the future, but providers are authorized to add counties within geographic service areas to their license. The provider would need to approach HQA in order to make that update. We also have certification status. As you can see from this, America Loving Care Home Health is both Medicare and Medicaid certified. You could also see Medicare certified only here. You could have Medicaid certified only or not certified. Certified in the Medicaid means fully enrolled, as in fee-for-service. This provider has told the agency that they provide pediatric services to individuals under the age of 21. If that had said no, and you had a pediatric client that you wanted to try and have this home health agency provide services to, you could contact them if the home health agency said that they were appropriately staffed in order to provide those services. Then we would just ask the home health agency to contact us and update their records. Again, this is permissive. The next line, I'm sorry, pediatric services is informational. The next line is permissive, special designation. In this case, if that said non-skilled only, you could not ask a home health agency to provide skilled care services. It must say skilled services here in order for you to staff them in that capacity. On the other side of the page, we have some general information, the license number, their current effective and expiration dates, the file number. Up at the top, we have information about who their administrator is and their financial officer, and the licensee, which is the legal entity that's authorized to operate the location. Oftentimes you will see a difference between owner/licensee and the name that is in the blue banner at the top. The blue banner at the top is the fictitious name or their DBA name. The licensee is probably the name that you have enrolled or have a contract with, rather. We also provide information on the entities that own the licensee itself. As we talked about just a few minutes ago, pediatric services should not be considered permissive. A yes response means that the home health agency has indicated on their last licensure application that they provide skilled services to pediatric clients. Since our first training a few weeks ago, we've already heard from a few home health agencies that have reviewed their information or have been approached by some plans, and they've reached out to us and asked us to please make updates to the Florida Health Finder. It takes us a few moments, and with minimal documentation from in order to make those changes, Florida Health Finder refreshes overnight, and what was a no would then become a yes the next day. Again, these are some additional screenshots to show you some differences in the way that providers can look. On the one that is on the left-hand side, we have Baycare Home Care Incorporated. You see at the bottom that they're both Medicare and Medicaid certified. We can also see that this provider is accredited by Joint Commission. They don't currently indicate that they provide pediatric services, but they do provide skilled services. Home Instead Senior Care, on the other hand, does not have an accreditation organization that is listed, nor are they Medicare or Medicaid certified, and they are limited to non-skilled services only. This particular provider would not be appropriate to perform skilled services, and as they are not accredited, they would not be eligible to be a participant in any Medicaid Medicaid plan. And now I'm going to pass it over to Nick.
Hi, good morning. This is Nick Constantino with the Provider Enrollment Unit in the Bureau of Medicaid Fiscal Agent Operations. To start today, I'd like to talk about the Provider Master List and the Pending Provider List. The agency provides 2 reports of provider data to Medicaid health plans. The Provider Master List, or PML, is provided to verify network provider Medicaid enrollment and for reconciling demographic data between any plan's database and Medicaid. The Provider Pending List, or Pending Provider List, whichever you'd like, or PPL, is provided to verify providers who have applied to Medicaid that have not yet received Medicaid ID. Both of these reports are available at the Medicaid web portal, and that can be found at the URL listed, www.mymedicaid-florida.com. To touch on the contents of the Provider Master List, all active Medicaid providers and those that are no longer active but have been active within the previous 18 months are listed on the Provider Master List. The contents include the provider type, the specialty, service address, the NPI, if applicable, taxonomy and zip 4, the professional or facility license, provides information regarding the enrollment type, be it fully enrolled, limited, or registered, the enrollment status, and the dates of eligibility. In addition, the provider's NPI information is included on the PML and can be used to determine if an NPI submitted in an encounter to your health plan will make a one-to-one match to the provider's Medicaid ID. Like Florida Health Finder, the PML is updated every evening, Monday through Friday, and the revised list is available every day, Tuesday through Saturday. Any changes to the provider record completed by close of business on Monday through Friday will appear on the next day's posting. Just one note, records do fall off the PML after a provider has been inactive for greater than 18 months. The pending provider list contains all the same information as the provider master list, with the exception, obviously, of the Medicaid provider ID, as it's not been assigned yet. Again, this information would fall off of the PPL if the provider, in this case, has been approved or denied, and will then transition to the provider master list. You can see at the bottom there, the last bullet point, any approved providers that were currently on the pending provider list, once they're approved, they will appear on the next day's provider master list. Just to touch on a couple of the, give some information on a couple of the content pieces of information that are on both lists, actually. The provider enrollment type is pretty important, and what that does designates the level of participation in screening under which a provider was assigned a Florida Medicaid ID number. The 3 values that are applicable for this field are fully enrolled, limited enrolled, and registered. Just to break down those 3 real quick, a fully enrolled provider, this enrollment type is is assigned to a provider that's been fully screened and credentialed by the agency. A fully enrolled provider can provide services to recipients enrolled in either fee-for-service or managed care. A limited enrolled provider, this is the assignment that we give to a provider that's been screened by the agency. However, they've been credentialed by you, the Medicaid health plan. Limited enrollment providers can provide services only to recipients who are enrolled in managed care. They're not eligible to provide fee-for-service services to Medicaid recipients. And then the last provider enrollment type is registration, or registered provider. I'm sure you're all very familiar with this, as you do this for many other provider types besides home health. but basically the registered providers are a type of enrollment that is assigned to a provider who's been screened and credentialed by you, by the health plan, and for whom the plan or provider submits a request for a Medicaid ID number. Registered providers, again, can only provide services to recipients who are enrolled in managed care. They are not eligible to provide services on a fee-for-service basis. More specific to this presentation, types that we're looking for here in specialties, let's take a look at those real quick, and we'll take a look at an example of the PML in a second, but just to sort of set the stage, what you're looking for here is provider type 65. This is the provider type that is assigned to home health services, and it is used for both licensed and unlicensed home health service providers. The provider specialty is key, and this is the information that will denote whether home health service, which services that a licensed or unlicensed home health agency is authorized to perform. The next slide here will show the various specialties that are eligible, or I should say some of the specialties that are eligible under provider type 65 home health services. The majority and the main one that you'll see is specialty 965. That indicates that that is a fully licensed, excuse me, fully licensed home health agency. If they are providing unlicensed personal care, you'll see specialty 114.
Excuse me, I have a question.
And as we'll also be including specialty 117 and 118, which are the new independent home health nurses. And 117 is assigned for a licensed practical nurse, and 118 is assigned to a registered nurse. So here's an example of what you'll find in the PML. If you look in the first column that has an arrow above it, you'll see that it indicates provider type. If you stretch that out in Excel or extend it or open it up, I promise you it does say provider type. And what you're looking for here is 65 to ensure that this is a home health service provider. The second arrowed column indicates, as we just talked about, the provider specialty. Typically, like I said, you'll see 965 or 114, and this is key to you as it will indicate, excuse me, it will indicate to you whether this is a fully licensed home health agency or an entity that is only licensed to provide unlicensed home health services. If you look at the box about halfway down the page on the left, you'll see that this entity, Dependable Nightingale, again has provider type 65. They have a specialty of 965, which indicates they're a fully licensed home health agency. But they do also, as I mentioned, have some other specialties that are eligible for that provider type. In this case, these are therapy specialties, but most of the time you're going to see 965, 114, and going forward, the 117 and 118 specialty types. As you move to the right, you'll see the column labeled enrollment type. This is where you'll be able to differentiate between the fully enrolled, limited, and registered provider types, or enrollment types, I should say. In this case, you'll see where it says enrollment, that indicates fully enrolled. If you scroll near the bottom, you'll see the entity there has an entry of registered, meaning that they are simply a registered provider. Moving to the right again, there's another column. It's not labeled with an arrow, but it does show the MPI for that provider. Moving to the right, the license for that provider. And then the last arrowed column there, that shows the actual status of the provider. An A in this column here would indicate that the provider is active. An I would indicate that the provider is inactive. And we don't have an example here, but there is another valid value for this column, and it is E, meaning that they are not eligible to provide services. So you should definitely not enter into contract with any entity that you see if they have a column. The last column is an indication of the dates of service that they're eligible to provide services. Anything that has a 12/31/2299 means that they have an open-ended date and that they're currently eligible to provide services. If you see a date that is in the past, that means that they were active up until that date. And should you have a claim that you need to submit that is within the date spans, the date of service, or it will fall within the date spans with that date as the end date, that claim can still be submitted. But if it's after that date, then they're not eligible to provide services. We've got some examples here that Dale will go over, how to use both the Florida Health Finder website and the PML in conjunction with each other to determine whether or not you should or can enter into contract with an HMO, I'm sorry, with an HHA provider.
Thanks, Nick. We have several examples that we're going to go through, some scenarios, some circumstances that you see in your day-to-day operations, and then based on those circumstances, what our determination would be. Under the first scenario, we have a pediatric enrollee that's currently residing in Bay County. Physician order says that this individual requires 24 hours a day, 7 days a week of PDN services. When you visit Florida Health Finder for the home health agency that you are attending to approach to provide these services, you find that the home health agency in question is in fact licensed. Their service area does include Bay County. They are Medicaid certified and accredited by Joint Commission. Their special designation indicates that they provide skilled services. However, it says no next to pediatric services. You next turn to the PML and it shows that their enrollment type is enrolled and they are active. The Medicaid number, NPI number, and license number all correlate to the information that you have on file. The provider type is 65 for home health services and their specialty is 965 for a licensed home health agency. Given all of these circumstances, our determination would be that this particular provider is able to be added to the network as a home health services provider. We would expect that the home health agency would contact the Division of Health Quality Assurance to update their licensure records within 21 calendar days to indicate that they're now providing pediatric skilled services. You do not need to wait for the Florida Health Finder record to be updated in order to go ahead and enter into your contract with this provider and get them providing services to the recipient or to the enrollee. We just need to get that information updated so that Florida Health Finder can eventually reflect the accurate information. Under scenario number 2, again, we have pediatric enrollee, this time residing in Pasco County. This individual requires 12 hours a day, 7 days a week of PDN. Florida Health Finder shows that the home health agency in question is licensed. Their service area is for Pinellas County. They are not certified. However, they are accredited with ACHC, the Accreditation Commission for Healthcare. They do have the Special Skilled Services designation, and they are showing that they're currently providing pediatric services. When you consult the PML, you find no findings for this particular provider. The determination in this case is that this provider is not able to provide services to the enrollee at this time. The issue is that this enrollee resides in Pasco County. However, the home health agency is only authorized to provide services in Pinellas County. In accordance with Section 59A-8.007, the home health agency would need to apply to the Division of Health Quality Assurance in order to attempt to add Pasco County to their license. our office would review their request and make sure that Pasco does fall into the same geographic service area as their license is currently issued for. In this case, Pasco and Pinellas are located in the same geographic service area. When licensure updates are complete, the provider would then need to be registered with Medicaid in order to provide services. Under scenario number 3, we have a pediatric enrollee residing in Collier County that requires 8 hours a day, 7 days a week of PDN services. Florida Health Finder information shows that they are currently licensed. Their service area is appropriate for Collier County. They are not certified, but they are ACHC accredited. They provide skilled services, and they also provide pediatric services. The PML, again, shows no findings for this particular provider. Under these circumstances, because the provider is licensed and accredited, even though they are not fully enrolled with Medicaid, they are acceptable to provide skilled services, but they would need to be registered with Medicaid before you could enter into a contract. Under scenario number 4, we have a pediatric enrollee with a developmental disability that is residing in Indian River County. This individual requires 4 hours a day, 7 days a week of personal care services. There is no record of the home health agency on Florida Health Finder, and likewise there's no record on the PML. Under this circumstance, this provider is exempt from home health licensure requirements in accordance with 400.464(5)(b)(3) of Florida statute. You could enter into a contract with this provider to provide personal care services only after the provider is registered with Medicaid. Scenario number 5, and I believe this is our final scenario that we have, is a pediatric enrollee residing in Marion County that requires 18 hours a day, 7 days a week of PDN. Florida Health Finder shows no active records for this provider. The PML shows that the provider is fully enrolled with an active status. The Florida Medicaid number does correlate with the one that is on your application. They have a provider type of 65 for home health services. However, their specialty is 114 for unlicensed personal care. Under these circumstances, this provider is not exempt from home health licensure requirements in accordance with 400.464(5)(b)(3) because they are seeking to provide services, both PDN, skilled services, and to an individual who is not classified as having a developmental disability. Therefore, they are not able to, this home health agency is not able to provide services to the enrollee. The provider is not licensed and not authorized to provide a PDN. That's the last of our scenarios, and so we're going to go back to Nick for a little bit to talk about the Medicare-Medicaid moratorium.
Thank you, Dale. On August 3rd, 2016, Centers for Medicare and Medicaid Services, CMS, announced an expansion and an extension of the temporary moratorium on enrollment of home health agencies in Medicare, Medicaid, and Children's Health Insurance Program, also known as CHIP, to include all counties in Florida. Previously, this moratorium applied only to home health agencies in Broward and Dade. However, they decided to expand the moratorium to include all Florida counties effective that date. The goal of this moratorium is to prevent fraud and safeguard taxpayer dollars while still ensuring patient access to care. Again, this was announced in the Federal Register on August 3rd. What this means for you is that any home health agency application submitted on or after July 29th, 2016 will be denied, simply denied, based on this direction from CMS. Any existing home health agency providers and suppliers may continue to deliver and bill for services, but again, no new provider and supplier applications will be approved. Excuse me. This does not apply to home health agencies who are seeking to enroll as a result of a documented change of ownership, which is defined in Section 408.803 of Florida statutes for an actively enrolled HHA. And it also does not apply for any home health agency seeking to register with Medicaid for purposes of submitting claims to a Medicaid health plan. So while we looked at the PML earlier, there were many HHAs that weren't fully enrolled. Going forward, though, that number will remain the same, as no new home health agencies will be approved. Just quickly to touch on registering a provider. Currently, I know that, as I mentioned earlier, you're all doing this for other provider types. This is a way to obtain a Medicaid provider ID number. I'm not going to bore you with the specifics of this. You all know how to do this already. Please continue to do so when registering home health agencies. It's the same exact application or paperwork that's necessary. So please continue to register all of your providers. Just one quick note on this, and I mentioned this in the first call. Keep in mind that when a provider registers, regardless of the provider type, and a number is assigned to a registered provider, that number is for that provider. It is not for that provider doing business with Humana, or that provider doing business with Sunshine, or that provider doing business with United. One number is assigned for the provider, and that number is usable by that provider when interacting with any health plan. Unfortunately, we do get several extra, I guess, registrations, and that goes to lead to some confusion. So please keep in mind that the first thing you should do when attempting to enter into contract with a new provider is ask them if they've already got a Medicaid number, so that we don't go ahead and create new numbers. If you want to just go ahead and go, yeah. So if we want to just take a look at what we have here, a checklist for one of the new provider types that Shamiria mentioned earlier, independent home health nurse. You can see here that there's 3 columns to the right. Those 3 columns indicate the enrollment type, whether it's a registration, a limited enrollment, or a fully enrolled provider, which documents are needed for those specific enrollment types. If you look at the top line, you can see the Florida Medicaid Provider Enrollment Application. That's only applicable for when you're enrolling this provider in a limited or a fully enrolled capacity. The next line down talks about the registration form itself, and that would only be applicable to providers that you're attempting to register. You can see the rest of the required documents down on the left-hand side, and going across which enrollment type they would be necessary for. We've got some frequently asked questions that we're going to turn back over to Shamiria. If you do have any questions regarding the registration, please forward them to your AHCA agency contract manager. I'm sure that they can answer them for you. If they cannot, they will forward them on to me, and we'll get them answered for you. I jumped the gun a little here. I guess I'm going to go over a few provider enrollment frequently asked questions before we turn it back to Shamiria. First and foremost, what information does a provider registration capture? The registration form captures demographic information such as name, address, tax ID, licensure, and MPI information. How does an HHA obtain a Medicaid ID while the moratorium on new enrollments is in effect? Again, home health agencies can submit a Medicaid provider registration. The Medicaid ID will be issued solely for the purposes of tracking encounter data. And again, registered providers are not considered to be enrolled in Medicaid, and as such cannot submit fee-for-service claims. The next question, if a provider is only going to be registered and not fully enrolled, do they still have to be fully licensed to provide PDN services? The answer to this question is yes. Regardless of whether they are registered or fully enrolled, any provider must be licensed to provide PDN services to Medicaid recipients. Do home health agencies need to register each licensed location? Yes, a separate registration is required for each AHCA license. All counties covered by a single license are covered under a single registration. Can a registration be submitted online? The Florida Medicaid registration, it's a paper form currently that the provider signs, completes, and submits to the health plan. The health plan would then sign the registration for eligible providers after checking the credentials, and they would submit the form to the Medicaid for processing. At this time, there's not an online submission process that is available. If a provider is included in the PML, do they need to register? As I mentioned earlier, one of the columns indicates the enrollment status with Medicaid, an A indicating active, an I indicating inactive, and the E, which we did not have an example of, shows as ineligible. In this case, the provider's record on the PML is for the correct type of home health services and the correct specialty, and they have an active status, then no, they do not need to register. You can grab the Medicaid provider ID number off of the PML, and you will not need to register them. We've got some licensure questions that Dale's going to go over as well.
Yes. So the first frequently asked question that we have in the licensure section is, can a licensed AHCA add counties to its license? We talked about that a little bit earlier, but yes, a provider can add counties to its existing license through HQA for a small fee, but only within the same geographic service area. An entirely new license is required to operate in counties in a different geographic service area. Again, as we talked about earlier, if you are attempting to credential a provider and you see that they don't have a license in the county that you're seeking for, simply just reach out to that home health agency and refer them to us in the licensure unit, and we will assist the provider directly. Can a licensed nurse registry apply to become a licensed home health agency as well? Yes. Florida statutes do not explicitly prohibit a legal entity from holding both a nurse registry and home health agency license. However, a licensed nurse registry cannot directly employ care providers. By definition, all of their care providers are independent contractors. Conversely, a licensed home health agency is required to directly employ at least one care provider. The entity may need to seek guidance from the U.S. Department of Labor on employment issues in order to make a final determination about whether or not this is possible. Our next question is about a home health agency that's contracted with the Department of Children and Families, DCF, and is already providing skilled care. Can I add them to my network without credentialing? No. Every provider added to your network must be appropriately credentialed. There are certain instances of licensure exemption for contractors of the Department of Children and Family Services, so you would need to make sure that this provider is appropriately licensed, accredited, and meets all of the conditions of participation underneath your plan contract. A Florida home health agency on Florida Health Finder shows that they're not accredited, but they are Medicaid certified. How is that possible? Requirements for licensure and Medicaid certification have evolved over time. Starting in 2007, certain initial applicants for licensure are required to be accredited. Home health agencies that were licensed prior to that date are not subject to that requirement. If there's a lapse in licensure or Medicaid enrollment, the provider is required to comply with current requirements and become accredited as providing skilled care. So that's why when we were talking about Florida Health Finder, we talked about that you needed to look for Medicare or Medicaid certification or the accreditation status in order to validate credentials. Right, that was the last frequently asked question that I had for licensure, so we're going to turn it over to Shamiria to answer some home health services questions.
All right, so the first question is an APD waiver provider qualified to provide PDN for health plan enrollees without waiver coverage? And as we stated earlier, only home health agencies that provide skilled or non-skilled services are required to follow the home health agency licensure requirements of Chapter 400, Part 3, when services are provided as a health plan network provider. And the only exception is for personal care services provided to persons with developmental disabilities as authorized under 400.464 5B3 of the Florida statute. So, you know, in this situation, if a provider is an APD waiver provider, they would still have to meet the home health agency licensure requirements, but they wouldn't still be qualified to provide PDN. Only licensed home health agencies are designated to provide skilled nursing services. The next question is, can a nurse registry provide PDN to health plan enrollees? The answer is no. Only licensed home health agencies or independent home health nurses, when a home health agency is not available, who are enrolled or registered with Florida Medicaid, may provide PDN, which is a skilled service. Now I'm going to talk about some helpful resources. We've listed the links to the Florida Health Finder. We also listed the link to the Home Health Services Coverage and Limitations Handbook if you had any, if you want to refer back for any additional information. We also listed the links for the Florida Medicaid Provider Enrollment Wizard. This is for limited or fully enrolled provider applications. We've also provided information regarding the managed care provider registration. When you go to this link, you will be able to find the Florida Medicaid provider registration form, the Florida Medicaid registration guide, the provider master list spreadsheet, and the pending provider list spreadsheet. Those are all be available under that link. We've also provided a direct link to the provider master list tip sheet and the pending provider list tip sheet. We've also provided the legal authority for home health services, which are governed by Title 42, Code of Federal Regulation, Part 440.70, Chapter 400, Part 3 of the Florida Statute, and Chapter 59A-8 of the Florida Administrative Code. We've provided you guys some definitions. These are some terms that were used throughout the presentation, and if you just wanted for your information to know how they were defined, we have these listed here. And now we're going to talk about the ad hoc report, and I'll turn things over to Patricia Cobb.
Thank you. Good morning, everyone. You've had a long morning and you've reviewed a lot of information on how to identify eligible Medicaid providers. If you can hang in there just a little longer, we're going to discuss the ad hoc report. As Dale said previously, we have received a few questions since the original presentation, and we'll try and touch on that as we go through the actual ad hoc report. On October 5th, 2016, the policy transmittal was sent out along with the actual ad hoc template for the requirements for health plans to provide a self-audit of current private duty nursing home health providers providing PDN services for children enrollees in the community. Now, the plans must report to the agency each Monday of the week, and this starts October 21st. They must report on all children enrollees who are currently receiving PDN services in the community by an ineligible home health provider, or those who are receiving less than 100% of private duty nursing services as ordered in the plan of care. The report is to be submitted no later than close of business Monday, and the health plans will continue to report until all transitions, and when I reference transitions, that means all ineligible providers are now providing care, and transition is complete with 100% private duty nursing services as ordered, and notification to cease reporting is received from AHCA. Now we'll look at the actual ad hoc templates. You see before you the first tab. There are 5 tabs completely. 2 are instructional. 1 is a summary of which we're looking at now, and 1 is basically like a worksheet what you will be working off of. The last is the attestation. All need to be addressed. On the summary, what you're going to see is basically what I discussed previously. The start date we have put up there for you on column C, row 2. You're going to start on 10/24. What we're looking to identify there and what the plans are being asked to identify is ineligible home health providers providing care to children in the community, like I had said, and also those providers, ineligible or eligible, that are not providing 100% complement of care as ordered on the plan of care. The next rows down, 4, 5, and 6, going all the way across, are basically your totals in transitions in progress. What we're looking for here is what you're totally working with week to week. So if you start on 10/24 and you've identified what the agency has asked to be identified, moving forward each week, 10/24, you'll have that all filled out, column C. Column D, for example, would be 10/31, the following Monday. So you would fill out column D, what has happened between 10/24 identification and 10/31 identification, so on and so forth throughout the actual summary itself. Once we have resolved row 7, for example, column C, if you have resolved eligible providers providing 100% PDN services, row 8 will auto-calculate. And we're going to be looking for that percentage and seeing how well the plan is doing on moving to the eligible 100% providers for their enrollees. Also note that there are 13 columns here. That's just an arbitrary number. It means absolutely nothing. It's not pursuant to the 60-day. All the provisions of the core contract are in play here. What the agency is expecting, and as you know from the core contract, is to provide the transitions within reasonable promptness. This is tab 2 of the actual ad hoc template. You can see, as I prefaced before, it is basically a worksheet, very self-explanatory. The instructions are on the 3rd and 4th tab. Every enrollee that you identify in the first column here should be included on the summary tab in that total number of enrollees identified we spoke of earlier. Column C3. So every child identified on the PDN enrollees tab 2 is what you're seeing in the total number of enrollees and what you're working with. Each column, each row has to be filled out completely. As again, we tried to make this very, very user-friendly. We're not asking to identify those children going through normal trials and tribulations of enhanced care coordination, normal trials and tribulations such as a nurse calls in shift and there's no replacement, although those need to be addressed. We are looking for the ones that do not have the 100% complement and I know I've said that multiple times, but the plan has seen them. These are the agencies where they receive an order from the physician for 24 hours a day, 7 days a week, and the agency decides to take the case, acknowledges that with the plan. The case is begun, but there's not enough staff to fill the 24/7. So what I personally call a sliding scale order on the plan of care is identified and signed by the physician as up to 5 days a week, 3 hours a day. What this in all looks like is basically they don't have the staff, they've accepted the case, and as they go through and try and hire more nurses, they're providing the care. This is not fair for your enrollees. This is not the expectation of the agency. If a case is accepted, they are to provide 100% 24/7, for example, from the beginning of start of services. Those are the enrollees we're looking to identify, and those are the agencies that have to be identified and that care needs to be as on the plan of care. So in summary, in this webinar, we discussed who can provide Florida Medicaid, skilled and non-skilled nursing services, how to validate a provider's credentials, a review of registering a new provider with Florida Medicaid, a few frequently asked questions, some helpful resources, and information on the ad hoc report. As Nick said previously, if you would like further clarification or any questions whatsoever, please contact your contract manager, your AHCA contract manager, and they will get the questions to who can answer them for you the best and direct you on this ad hoc report. We look forward to seeing it on October 24th